Good evening, everyone. Welcome to today's Journal Club discussion in the celebration of World Trauma Day. I'm Zahra, and I will be your MC for this session. Today, we have a pleasure of speaking with two special guests, Gabriela and Siew, the authors of the article titled "World Trauma Day: An Opportunity for Change." Their work provide critical insights into trauma care, its challenges, and the potentials for improvement globally. Let's kick things off with a brief introduction to World Trauma Day. Gabriela, could you share with us with the background and significance of this day?
Sure, Zahra. World Trauma Day is observed every year on the 17th of October, and it was first established in 2011 in New Delhi, India, in response to the city's high rates of road traffic. Over time, the day has gained recognition, especially through NGOs like InciSioN, as a vital opportunity to raise awareness about trauma prevention and the importance of timely, safe emergency care. Despite many advancements, we still face major challenges in ensuring proper trauma care access, especially in developing regions. This is why it's crucial to use this day to advocate for better trauma assistance worldwide.
Thank you for that introduction. Siew, trauma care is such a critical issue. But as your article mentions, there are still many regions with poor outcomes of trauma injuries. Can you tell us why these poor outcomes persist despite advances in medical technology?
Absolutely. Poor outcomes are largely due to systemic challenges. In many regions, there is a lack of trained first responders, insufficient ambulances, and even shortages of hospital beds. Pre-hospital emergency response is inefficient, which delays the crucial interventions during the golden hour. And even with the recent technological advances, these resources gaps remain prominent in low and middle income countries. Additionally, public health systems in some areas lack the infrastructures to manage trauma effectively, contributing to high mortality and disability rates.
That is a sobering reality. Moving on, Gabriela, what changes have you observed over the years regarding access to safe and timely trauma care? Has there been any improvement, or we are still facing the same issues?
Unfortunately, we're still facing many of the same issues. While trauma care technology has improved, access remains unequal. In particular, low resource settings continue to struggle with delayed care, lack of facilities, and untrained workforce. Many regions still suffer from poor pre-hospital emergency responses, which leads then to significant affection of trauma outcomes.
That is disheartening, but I'm sure there is a hope for improvement. Isio, in your article, you mentioned ways to improve pre-hospital trauma care in low-resource settings. Can you elaborate on some practical steps that could make a difference?
Well, in low resources settings, we can make a significant difference by training community first responders. This will empower local community to administer basic first aid before medical help arrives. And we also need to expand ambulance services and to ensure that these are properly equipped. Strengthening emergency communication networks and providing even basic medical supplies in ambulances could drastically improve outcomes. And these steps may seem small, but in emergency case, every minute matters.
Absolutely. Now let us shift gears a little. Gabriela, can you explain what physical trauma is and how the injury severity score play a role in managing trauma cases?
Yes, sure. So physical trauma refers to injuries caused by external forces, which can be classified as blunt, penetrating, or perforating. The ISS, which is the Injury Severity Score, is a tool used internationally to assess the overall severity of trauma. It looks at multiple body regions, evaluates the extent of injuries, and gives an overall score. This allows healthcare workers to prioritize treatment, allocate resources more efficiently, and communicate effectively with other professionals about the patient's condition. In this way, the ISS helps streamline trauma management and ensure that the most critical patients get the care they need first. This is especially relevant when there is an accident or natural disaster with more than one patient.
That is fascinating. I guess ISS seems to be a key factor in ensuring the appropriate care. Now, road traffic accidents are a major cause of trauma globally. Issue, what are some strategies we can implement to reduce road accidents, injuries, and deaths?
One key strategy is promoting road safety educations. So teaching people the importance of following traffic laws, wearing seat belts, and using helmets, improving road infrastructures like adding pedestrian crossings and speed bumps in the high traffic areas also plays a role in reducing accidents. Enforcing strict traffic regulations and increasing law enforcement presence can further prevent reckless driving. And finally, ensuring that emergency medical services are always available and equipped to handle road accidents can help save lives when accidents do occur.
Excellent points, Gabriela. Trauma is not limited to road accidents. It also stems from violence, natural disasters, and other causes. How can trauma system be better equipped to handle such diverse causes of trauma?
That is a great question. Trauma systems need to be more adapted and prepared for various injury cases or causes. These casualties involve a lot of different aspects, and we have to have emergency protocols in place first for them. Training first responders to deal with different types of trauma, for example, improving infrastructure to handle large-scale emergencies, and etc. In addition, raising public awareness about safety and preparedness can significantly improve outcomes for trauma related to violence and natural disasters.
Siew, your article mentions that only 10% of people who need rehabilitations are actually receiving it. What can be done to improve access to rehabilitation services?
To improve access, we need to increase awareness about the importance of rehabilitation as a critical component of trauma care. So expanding access in underserved areas is essential, which means training more specialists and securing fundings for rehabilitation programs. It is also important to integrate rehabilitations into the overall trauma care system, ensuring that patients have access to necessary services throughout their recovery process.
Absolutely. Gabriela, can you share your thoughts on what steps can be taken to improve trauma outcomes from prevention to rehabilitation?
We need to adopt a holistic approach to trauma care. This includes promoting injury prevention through education, ensuring swift emergency response by training first responders, and establishing specialized trauma centers for severe cases. Expanding rehabilitation services is also essential to support patients in their recovery journey. Monitoring outcomes and continuously evaluating our trauma system are key to making improvements over time.
That's right. And finally, Siew, can you explain the significance of golden hour in trauma care and what resources are crucial during this time?
The golden hour is the first hour after a traumatic injury, and it's considered critical for saving lives. The immediate medical intervention during this period can significantly improve survival and outcomes. And the key resources during this time include rapid emergency medical services, ambulances equipped with proper medical supplies, and access to specialized trauma centers. Having trained first responders and effective communication systems in place to coordinate care is also crucial to ensure that patients receive timely treatment.
Thank you so much, Gabriela and Siew, for this insightful discussion. It is clear that there is still much work to be done to improve trauma care globally, but your article highlights many critical areas where we can make a difference. As we approach World Trauma Day, let us all remember the importance of raising awareness, advocating for policy change, and working towards a future where everyone has access to timely and effective trauma care. Thank you so much, everyone.
Thank you, Zahra and Gabriela. Thank you.
Thank you.